let's talk about that because I saw you goblet squatting a big ass dumbbell the other day, and I was like, that's when I invited you on the pod. I was like, we got to get her on.
I love to weightlift. I historically, I was not a weightlifter a long time ago. I mean, in my 20s, I posted about this. I mean, I was a step aerobics girl. I mean,
that's
and
fun.
I still love step aerobics. Like, give me a sequence, like some choreo, and I'm there. So I was that girl. Lots of aerobics that I loved. And then I had this, and I posted about this a little bit, but I had a really bad back injury. So when my son was born, he's 16. When he was 6 months old, I had him on his changing table, and I was changing his diaper, and he was like, 6 months and wiggly, and he actually fell towards me off of the changing table, and I caught him in a way and immediately had pain on the right side of my back. And then over the next few years, kind of I would have that really acute 10 days of I can barely move sort of pain. And then it would like work itself out and I'd be okay. And I was a resident. I was working like 100-hour week. I did not have time for back pain or to get help or do anything about my problem. Then I had my daughter, and on my 31st birthday. And when she was 1, we went to pick up my son from school. And there was another mom, lots of moms there. And another mom had her dog, which was a spaniel puppy on a lead. She had him totally under control, but the puppy sort of like, Ava was tiny. She was a year old, and I was holding her hand, and she was like toddling along. And the puppy sort of like sprung towards Ava, was not close enough to get to her. The woman had her under control, but I sort of panicked and grabbed Ava and immediately had searing pain down my right leg. And over the course of the next few days, I was unable to walk. I lost the ability to use my right leg. And I ended up, they thought I had caught equina. I was in MRIs and all of this emergency stuff, thinking there was something really wrong, but I had slipped 2 discs. And after that, I took over many, many years, I recovered. I was offered surgery at the time. I was afraid. I was working. I didn't have time. And I moved around that time, I moved to the US, and I was still doing my aerobics. And then I decided, you know what I need to do? I need to do Pilates. That's going to help me. And so I started to do Pilates and bar and all this stuff. And my pain was not better. It was getting worse. And I ended up seeing a PT very near where we live. And she saw me and she was like, everything you're doing is wrong. What are you doing? I need you to stop doing Pilates. I need you to stop doing it. I need you to lift weights. And I thought, I can't lift weights. My back hurts. What are you talking about? I can't lift weights. And she said, just trust me. I'm going to help you lift weights. And if I don't lift weights, my back hurts. Heavy weights. And if I don't lift weights, I get my sciatica pain back immediately. So it's like a harbinger. I was like, oh, nope, and I'm not lifting enough, or you're not lifting heavy enough or frequently enough because your back pain is back. And people think that's so surprising. And after I posted that last week, after that conference that I went to, people reached out to me and DM'd me, really? It doesn't hurt your back? And I said, no, as long as you're with somebody that can teach you how to do it properly, you can really change the course of your back pain with weightlifting.
And change the course of your life.
Totally.
I mean, it's just non-negotiable. And I've been, I came online in 2016, and I was just beating the drum, like deadlift and eat steak. And it was not popular because the health gurus of the time
were in the plant-based world.
Yeah, they were like, do yoga and go vegan. And I was like, eat meat and lift weights. And it was not popular. It is popular now. And I'm so excited that it is. But I have a program where it's an online program where I teach women how to strength train beginners. And it's amazing. Every time I post about it, the amount of whataboutisms, pushback, and women arguing for their excuses in their limitations in my DMs is just bewildering. Cause I'm like, this is like, I saw a doctor the other day. I actually reposted her. She was on a podcast. I can't remember her name, but she said, if you're not willing to lift weights, you might as well just start picking out your nursing home.
It's true.
And people wrote me back and they said, you're fear mongering. And I'm like, no, I'm not. I stand by every word she said.
It's true.
Yeah.
And I've seen it. I've taken care of those women. My entire training and the start of my general practice training in the UK. So the way that each of the clinics would cover a certain catchment area, and any nursing homes that were in that catchment area were our responsibility. So every day we would be rounding in the nursing homes and, taking care of people and seeing people. And let me tell you, all of them were women and all of them were fallers. Frailty is the reason that women end up in nursing homes. And the only way to combat frailty is to lift heavy things.
Amen. That is It is it. This is non-negotiable for everyone listening. You have to find a way, and the information's out there now. There's so many online resources.
There is so much. Yes.
This is not, I call it my little granny lifting because I have severe back issues myself. And so it's my little granny lifts, and I focus heavily on my glutes. I focus heavily on my lower body because that is how we are going to build the biggest mop to soak up that blood glucose and the blood sugars and regulate our metabolic health.